Yes, welcome to today's talk. We are continuing with secondary hypertension, not hypertension. Look at me. We are continuing with secondary headaches. We did our primary headaches, and now we want to do secondary headaches. Secondary headaches. We have discussed about primary. Primary comes as a disease of themselves, but secondary comes because of something else. And just a review of what we did last time, we talked about several classifications of secondary headaches, and there is something called ICD-3, International Classification of Headaches, Disease, Complication, International Classification of Headache Disorders. And according to International Classification of Headache Disorder, we have classes that are like this. There are about 4. Headaches attributed to trauma or injury of the neck and head, because your neck holds the 12 cranial nerves. And then we go into headaches attributed to cranial nerve or cervical vascular disorder. Vascular are like veins and arteries, including the nerves, because they are attached. Say, oh, Jamaican uncle, welcome. Now we went to the other one, and they have their subgroups. Well, we went to another one, which is headache attributed to non-vascular intracranial disorders. Like which one? Like tumors when they grow, that is not a vascular thing, that is something else. So we don't call it vascular, we call them non-vascular intracranial disorders. Welcome everyone, and if you come in, you say in the chat that I'm here, like Jamaican uncle has already said hi, big up all the time. Now let me push this here so that I can see who is getting in and out. Yes, we're talking about headaches. And when we started headaches, people thought it's just headaches that we'll take analgesics and then we are good. You see, headaches is a very big topic, and we didn't even finish primary headaches. So here we have secondary headaches. We will review treatments of primary headaches because we did not do them the way they are supposed to be done. But the way we went, it was good. Now, trauma, headaches attributed to non-vascular disorders, and then we have idiopathic intracranial hypertension causing headaches. Yes, idiopathic means anywhere you hear about something that is idiopathic, it means it is not known, attributes are not known, it is just a headache. So when it comes, we will see headache attributed to substance overuse, people that use drugs, alcohol, cocaine, or chronic diseases, and then you are taking drugs continuously and you are having the headaches. That one is another thing. It's an attribute to that, because we said what? Secondary headaches comes because of something else. So here we will start with the first one. We have many. We have headaches attributed to disorders of hemostasis. Headaches attributed to disorders of hemostasis, and headaches attributed to disorders of the eye. When we talked about primary headaches and we saw about trigeminal autonomic cephalgias and migraines, you saw when you are on bright lights, you can start having headaches because of bright light. So this is headaches attributed to disorders of the eyes, like uveitis, refractory errors, and glaucoma. People that are diabetics, we will see that. Headaches attributed to ear disease, headaches attributed to ear disease, vestibulocochlear. When you hear about ear disease, you talk about vestibulocochlear. Vestibulocochlear is the 8th cranial nerve of your body, of your head, not your body. The other one, the body nerves are called spinal nerves. So let's go through the 12 cranial nerves, but let's finish this. We have headaches attributed to nose and sinus disorders, and headache attributed to dental disorders, headache attributed to disorders of the neck, and headache attributed to psychiatric disorder. You know, we talked about mental issues, and we came across headaches in depression, headaches in anxiety disorders, and somatic diseases. And many. We have 10 types of secondary type of headaches. 10 types of secondary types of headaches. 10, just imagine. So we will start with the first one, which is very common. We will start with the first one, the common one. I've said secondary headaches are classified under International Classification of Headaches Disorder 3. There are some people who sat and then they discussed headache in a board for long years, several people. So they came up with these classifications. Whenever you read any book, medical book or any other book, and you see item ETOL, it means it was a group thing. So my friends and everyone who is here, the chat, I want to know who is watching. Just don't watch and you keep silent. Who is listening, who is learning? You come to the chat and say that I am this and this, and I come from this country. Yes, country is okay. I come from the US, I come from Africa, I come from Russia, and I come from every state that you are in. If you are watching, come to the chat, tell us where you're watching from. Now, let's talk of classification of secondary headaches. The first one, headaches attributed to trauma or injury to the head and neck. The head and neck is whereby you have the 12 cranial nerves. You see, 12 cranial nerves. And when we talk about the 12 cranial nerves, they are the one that innervates senses, sense of touch, sense of sensory, sense of smell, sight, along the 12 cranial nerve. Let's name them. We go to olfactory, optic, oculomotor, trochlear, trigemina, abducens, facial, vestibulocochlear, we go to glossopharyngeal, and then we go to vagus nerve number 10. Then we go to accessory, spinal accessory that helps you to turn your head and shrug your shoulder. And then we have the last one, which is hypoglossal. Hypoglossal, movement of your tongue and sensation of taste. The nerve, which is the 7th cranial nerve, it innervates the 2/3 of the tongue when it comes to taste. It comes from your brain and has a branch somewhere here, along somewhere, that is called the conta tympani, and then innervates. You see, so these are the things that we want to look at, because when you have a problem with the cranial nerves, what happens is, when you have a problem with the cranial nerve, what happens is they produce some inflammatory markers on their own, not like the muscles and the others that produce prostaglandins that come there. You remember, we have talked this at the primary headaches. They produce something called calcitonin gene related peptide that causes pain. They produce something that is called substance P, and they produce other thing that is called neurokinin A. When nerves produce these three, you start having a problem. But right now, we are talking about a very different thing here, and this thing is called headaches attributed to trauma or injury to the neck and head. But if you have trauma in the head and neck, it means you are having a problem when it comes to the nerves. The nerves and the what? You're having a problem when it comes to the nerves and something that is called blood vessels, vascular system. Blood vessels, you talk about vascular system. So headache attributed to trauma or injury to the head and neck is the topic that we are starting with. Occurs after physical injury. Your head having a physical injury, and having a physical injury, it entails three things. Physical injury of your head and neck, it entails three things. One, it entails what? Concussion. Two, compression. And three, contusion. So concussion means you have abruptly hit your head. There is no injury at the muscles, motor function, and the skin, but the inside, because of you get what? A problem, because your brain receives some shock. Contusion, you said, is when a substance goes in and interrupts, like a bullet wound, a spear getting through. Or the other thing is when you hit your head somewhere, you get it. There is something called whiplash, a neck injury caused by sudden force backward. Imagine you are driving your car and you are taking emergency brakes and you are not told the passengers you are having that I'm taking a break. So their head will sway in front and back suddenly. So there will be an injury around the spinal cord at the C, the atlas, mostly at the atlas, and then we go at the C1 bone down there, spinal bones. So it is called a whiplash. What does it do? It strains the neck muscles, ligament, and joints around the neck. While many recover within few minutes, untreated cases may lead to chronic pain. That is called a whiplash. And the vagus nerve also comes to the neck and drops down to the heart and goes to the stomach, somewhere there. It innervates parasympathetic nervous system, slowing down. So when you are injured somewhere around the neck, it means you have a problem. It means you have a problem inside. You see that? Batista from Brazil. Batista, welcome to class. Welcome to class. Now, intracranial hematoma. What is hematoma? Hematoma means bleeding from these blood vessels, like a circle of Willis. And then you have posterior communicating artery. We have common carotid artery around your. Look at this. There is internal carotid arteries. There are two that comes here, and then they form Jayana is here. You have a circle of Willis here. So anything that may make these vessels to bleed, these vessels that you are watching here, you've seen them. Anything that will make these vessels to bleed, it means you will have a hematoma. A hematoma is blood flowing out of your vein, and then it is clotting and causing compression to the brain meninges. So you will start having a headache. You see, introduction of headache attributed to trauma or injury of head and neck. Jayan is here. I see Batista from Brazil and Uncle from Jamaica. Welcome all of you to this session. And if you have a question, you don't keep it. You ask it so that we can discuss all of us. No pending questions. No pending question. Learning is a continuous process. Let's continue about the concussion, skull fracture. All these are traumatic sessions. You hit your head, and there is one that I've discussed: whiplash and cervical spine tumor. Most of them you will get headaches, and it may be abrupt or it may be gradual. So when maybe one day you are in a bus and then you have an abrupt break, the driver gets an abrupt break, you get, and then you go home very well, very nice, but the first thing is mental trauma. You have mental trauma because abrupt breaks and you're not aware. You will have mental trauma. And then the other thing is you will have a whiplash. Whiplash is the cause. Whiplash is the cause of headaches after you've been on a long drive, and then you get home, you start having headaches. It is called whiplash. Because of you do this and then it comes unaware, then you start having strain. So when you accidentally lay your head in front and back, you know what happens to your nerves, because nerves have come to the head, they are innervating the eyes, and the 10th cranial nerve, which is the vagus nerve, has dropped to your neck down to the other systems. So they start producing calcitonin gene-related peptide, calcitonin gene-related peptide, and substance P and neurokinin A. So when the nerves, the 12 cranial nerves that I've named from your head, starts to produce those, they are markers of inflammation. So your brain manages, and even the blood vessels in the brain, they start to produce them. Like they start to vasodilate, and then they come, and your brain function starts to start having a headache. So you might be traveling from long Jafo Doctor, glad to listen to these health insights. African Mom, welcome. Those people that travel long distance, I'm an African, and those I can see someone named herself African Moms. Yes, when you travel long distance and then you are traveling from the city by bus. In Africa, we do by bus most of the countries. Unless your pockets are good, you can do a plane. And then you go a very long distance. The first thing is fatigue. Whiplash always comes in. Whiplash always. Yes, whiplash, because of your of swaying like this. You are always swaying. The roads are bad. Then you get home, you start having a headache. Now you know why. The tendons around the neck are having a problem. The nervous system are undergoing inflammation, because the more you turn your head, the more you have the whiplash. The substance, the nerves produce those things, and that's why when people travel for so long, when they get home, they have headaches. What about the type of headache that wake up with? The type of headache that people wake up with. That one I'll talk about it in 2 dimensions. If you go to bed without eating well, you will wake up with a headache. If you go to bed, just a minute. If you go to bed without taking enough water, rehydration, not water. I don't like saying water. If you go to bed without rehydrating, you will wake up with a headache. Doc, every time I travel to Western, 6 hours, I get a headache. Yes. Africa, we have bad roads. And every time we are traveling from Nairobi to Western, that is like 6 to 8 hours. What will happen? You are always having a whiplash. Whiplash is swaying your head. So you are swaying your head. And let me answer the Jayan. Jayan says headaches that people wake up with. Poor sleeping quality. Teeth grinding, stress and anxiety, dehydration, alcohol, excessive caffeine withdrawal, Uncle, you like caffeine, high blood pressure, and medication overuse. So, Jayan, which one of those do you think might be happening to someone or you? Yeah? Deep during sleep, repeated airway obstruction can cause. Some people, they go to sleep and they take blankets up to the head, and then breathing becomes a problem. So when breathing becomes a problem, what happens? When breathing becomes a problem, you are having hypoxia. When breathing becomes a problem, you are having hypoxia, and you will wake up with headaches. So that is, Jayan, look at this. Poor sleeping quality, how you get into blankets up, cover even your face. Someone with high blood pressure, overuse of headaches, medication, painkillers, excessive caffeine withdrawals, dehydration, stress, or anxiety, all of those can and also we are talking about a secondary hypertension, and secondary hypertension is associated to something. If you are waking up with headaches every time, you really need to consider to do the general checkups, full hemogram, and the normal checkups, kidney function, liver function, and check it out, the normal random blood sugars, so that you can know what is happening, And remember, we are talking about secondary headache, something attributed to something else. So as I come back to African mom, I say, African roads are bad. They are not smooth. I did all, but everything is normal. Everything is normal. What about fasting and random blood sugars? Which country are you from first? Because altitude can be the problem also. Altitude can be the problem. If you are born in Africa and then you go to a country that has high altitude, UK, you see, the transition can bring a problem. And then check how you sleep, quality of sleep. If you are working and you're overworking and you're going home so tired, but I have high blood, Jayan, now you're talking, but how high? Are you on medication? If you are on medication, it's also another thing. You should have a medication on that. It means check your blood pressure for 5 days. You can WhatsApp or email me the readings. If you have the blood pressure thing machine, can WhatsApp and email me randomly anytime, but make sure you write time and date. So I will advise you more about it. Now that we have talked, you have high blood pressure. Now, African mom, Kenyan roads are bad. Every time you travel 8 hours, you are tired because the state of the bus that you are traveling with. No, yes, but mine, because my blood pressure only goes up when I have a headache. No, it means the blood pressure starts to go up, then the headache comes, not the other way around, Jan. The blood pressure is what brings you a headache. So when you go and check your blood pressure, they are high, and you have. So the headache is a symptom of what you have. But I may advise you to take the readings for 5 days randomly, at least twice or once a day. The time and date, then you email me or you send me on my WhatsApp. I may. Yes, I always feel different when I'm the Kenyan coast. Could this be? Yes, it is altitude effects. Low altitude, high altitude, different oxygen levels, different oxygen levels, you might feel a headache. But not traveling for 8 hours on wrong roads with buses that are not comfortable, that is another problem again. You are always being swayed, having whiplash of the neck every time, and then the nerves themselves that comes on through the neck down to the head, they start having inflammation, and then you start having headaches. Because if you irritate a nerve, it will produce calcitonin gene-related peptide and substance P and neurokinin A. And those ones are the culprits. They are the ones which make you have headaches. Even if you hit your arm or somewhere, the place that you have hit, it will swell because it is prostaglandins. And when prostaglandins are there, they are the culprits that they are helping you, but at the same time they are giving you pain. You see? So when you are traveling from the coastal region to the western side, you try and get a good bus that you can be comfortable, and you tell the driver you don't drive straight, some air somewhere twice midway. I know from Nairobi to the western region that is like 8 hours, and then from the coast I'm not sure. So JR, you do that. I'll do what I've told you. I'll help you how to wake up without a headache. But the first thing, or you can talk to your doctor where you are. The first thing you need to get the readings for 5 days, and tell me also if you are on any medication. If you are on any medication, that will really help. Now let's go to. Continue, or is there anyone who has any question as we continue? Anyone who has any question? And please, when you're watching, you tell us where you are watching from. You tell us which country you're watching from and interact. Don't just drop, my friends. Tell us where you're watching from. Let's listen from you. Some people have good insights when it comes to medical things. So welcome everyone. Now, when you come to headaches attributed to traumas of the head and the neck. Headaches attributed to traumas of the head and neck. We have said the causes are concussion, skull fracture, intracranial hemorrhage, bleeding from the cranium, whiplash. Thank you for your advice. Go back to work now. Good. Thanks. Welcome. Jayan, welcome. Now, cervical and spine trauma. Cervical and spine. The spine is what holds your what? The spine is what holds your spine, the cervical region here, plus the spinal cord. We call it the cervical spine area. Now, traumas, how are they caused? Brain tissue injury, something if you hit your head, your skull is a very tough one. It may traumatize, it may injure your head. Stretching of pain-sensitive meninges. You see, pain-sensitive meninges there are some places in your brain where the pain receptors are. So when you stretch them, because the blood vessels are dilating and releasing the inflammatory markers that I've told you, calcitonin gene-related peptide, substance P, and neurokinin A. When they are stretching at the pain receptors, you will feel a lot of pain. Hey, hello, Benjamin and everyone. King Ray, hi King Ray. Judy, hope you are doing good. Hope you are doing nice. Inflammatory mediators release. Let me talk about inflammatory mediators release. In a slow and a good way. I'm from Kenya, Africa. Even me, I'm from Kenya, Africa to the world. Kenya, Africa to the world. My home is Western Kenya, a place called Bunyore. We call it Little Jamaica, Bunyore. So I'm Dr. Bell and the teacher right now, the lecture. Welcome everyone to this talk. Now, let's talk about inflammatory mediators. How you feel pain. Because when you are injured, there are some people who are injured and they don't feel pain. Have you ever come across someone that is injured and there is no pain? Or sometimes you go to someone to hospital and they want to give this person an injection. You kind of like be confused because the guy never feels any pain. Any injection even sways. No. Now, what happens? Is because these people have reduced pain inflammatory mediators. And what are the pain inflammatory mediators? What are the pain inflammatory mediators? There are several types of pain inflammatory mediators, several types. Somatic body cells, they have prostaglandins, inflammatory mediators. And you remember we talked about inflammation. Just a minute. We talked about inflammation. What is inflammation? Let's start from there, because with inflammation, understanding what inflammation is, you will understand so well how headaches come when it comes to head injury. Inflammatory mediators are substances released by cells or proteins during inflammation. Inflammation is a response to trauma. If your response to trauma, how your body responds to injury, they initiate, amplify, regulate, and eventually resolve the inflammatory response. They are responsible for classic signs. I'm talking about inflammatory mediators of inflammation. So when you are hit somewhere, you swell. That is a sign you have had a trauma. Heat, when you feel there is heat. That is a sign you are undergoing inflammation. And then there is the normal one. If I hit you or fall down, you get an injury, you feel pain. That is an inflammatory mediator. And loss of function. So one of the things I want to say is histamine, released by basophils, white blood cells. Yes, my white blood cells are classified into basophils, mesophils, lymphocytes. You remember them? Mesophytes. But lymphocytes are classified into basophils, NK, natural killer cells. You remember the lecture. Yeah. So they release some things like proteins that are called immunoglobulin E that makes you feel pain. Something like histamine, when it is released, you will feel pain. Serotonin 5-HT, you will feel pain. There is something called arachidonic acid metabolites. When they are released, they make somewhere that you have been hit. And why do you feel that? You feel that because when you are hit, you swell. It helps more blood to come. Hello, Dr. Dorothy. Welcome, Dorothy. Welcome. It makes more blood to come at that area, so that cells like natural killer cells, basophils, you see, all leukocytes, white cells, to clear the destroyed cells so that healing come on well. But the vasodilation means an area that is swollen. You vasodilate an area that is swollen, like what? Let me see this. The proper words to use is like capillary arteries dilation. It makes more blood to come there so that you can better. But when mediators of inflammation come, you feel pain. There is something called cyclooxygenase. It is painful. It brings something called prostaglandin E. That one is the one which makes you feel pain. But let's talk about the nerves. I'm fine. Hello, everyone. Let's talk about the nerves, because now we are talking about secondary headaches. And I've talked about nerves for so long. When you injure your nerve, because it has to heal by itself, when you injure a nerve, remember the 12 cranial nerves that we talked about. When you injure a nerve, what happens? What happens is, it produces, just like the body cells producing the other things like prostaglandins. There is a pathway called arachidonic acid pathway. The nerves produce something that is called calcitonin gene-related peptide. Painful thing. It also helps the nerve to heal. And when it releases this thing, that is where now you start feeling pain, headaches, because the nerves, when the calcitonin gene-related peptide, neurokinin A and substance P are released, they make the area around where they are released to start swelling. And if your brain meninges are swelling, what do you feel? You start feeling pain. See, that is what we call secondary headaches. Secondary headaches. Inflammatory mediators release. I was explaining about that. Blood vessels damage and sensitive. That is how pain comes. How does headache come? On the topic we are talking about is headache attributed to trauma or injury to head and neck. Traumas attributed to head and neck. So if you have a traumatic episode, if you hit your head, if you have a concussion, if you have a skull fracture, if you have intracranial hematoma is you are bleeding from the skull, from one of the vessels, you have a whiplash or cervical spine trauma, you have fallen down and hit your neck and the spinal cord. You can injure your brain. You can injure, your brain can hit where the pain receptors in the brain are. Or even your blood vessels can damage. And if your blood vessels damage, they can start bleeding from inside. And what will they do? After that, they will release inflammatory markers, the ones that I've said they are released. Prostaglandins if a vessel is damaged. But if it's a nerve that is damaged, always. These are the three things that I usually talk about. And then you'll start having a headache. And also losing a lot of blood when you are injured it's called hypovolemic shock. We will talk about hypovolemic shock. So the features that come in are like these features that come in, clinical features. You'll get headache begins after trauma, dizziness, sometimes you feel nausea. And why do you feel nausea? Why do a person who has a headache can feel nausea? It means that this person, if one day you have a head injury and you start feeling nausea, just know cranial nerve number 5, trigeminal nerve is affected. And do you know why? It is causing sensation up to the olfactory cranial nerve number 2 to start, because you see sensations of trigeminal comes like this. It has 3 divisions: mandibular, maxillary, and ophthalmic, and then we have just right next olfactory. So if it is injured and it is producing calcitonin gene-related peptide, here olfactory has a problem. So you start feeling nauseated, you start feeling like vomiting. So when you have a headache because you have hit your head or you have fallen down and then you start feeling nausea, just know this region, the nerve that comes 3 times, mandibular, maxillary, and ophthalmic, plus olfactory, they have an injury. See, you need to take rest and to take antidepressants. And why do you take antidepressants? To excite receptors of serotonin so that they can suppress what the nerves are bringing up. See that? So the features that you will have when you have these injuries, when you hit your head and there is a problem that I have to go to hospital. Neck pain, sometimes even turning is a problem. Call it knuckle rigidity, inflammation of the meninges and the nerves. Difficulty in concentrating, vomiting, nausea, dizziness, headaches begin after trauma. Any headache that begins after trauma means your cranial nerves are affected. Chaudhra Hamagaman, like Dan. Chau, your name is very long. Chau is from India. It's called a teach. Chaudhariya Megraman. Hello, my brother. Hello, Chau. Let me just call you Chau. Chaudhari. Hope I'm calling it in the right way. I hope I'm calling it in the right way. So they will go slow. We want to understand these things. Only Ahmed. Yes, that one is good. Ahmed Tik, I'll be calling you Ahmed. From today, your name is Ahmed. Yes, so we are talking about headaches, Ahmed, and headaches that are brought by head injury. And it is important to know when you have a head injury. Let's see, when you have a head injury, what are the bad signs that you should know? I have to go to warning signs. Warning signs. Let's talk about warning signs of head injury. Like you've hit your head, or you have slipped and you hit your back, or you have hit somewhere and you are there lying down. What are the warning signs? What should show you that no, I must not sit at home, I have to go to hospital? Loss of consciousness. If you are around a person who has lost consciousness, any loss of consciousness, even brief, difficulty in waking up, excessive drowsiness and reduced level of alert. You are feeling like you are drowsy after head injury, like you want to sleep. Hospital. You should not stay home. Severe or worsening headache, a headache that is throbbing. You remember? Persistent headaches that become progressively worse. It may be showing that you have a hematoma, bleeding from the meninges, or trigeminal related headaches, or trigeminal autonomic cephalagia, reduced level of alertness. If you have sometimes trigeminal related cephalagias are group of headaches. Trigemina is a fifth cranial nerve, automatically bringing, you may start vomiting and you may start losing consciousness. What is today's topic? Today's topic is secondary headaches. Headaches that are caused because of head injury. Topics that are brought because, yes, I am. Yes, I am. Because of head injury. You see, they are very important. You know that when you have loss of consciousness, difficulty in waking up, excessive drowsiness, reduced level of alertness, and any loss of consciousness, even if it is brief, don't stay with someone. Tell that person, come to hospital. Severe or worsening headache, progressively, it may show you have something that is bringing it progressively. Vomiting after head injury and confusion. Confused words. A person that cannot comprehend any word. Sometimes you take painkillers and they are not relieving it. These are signs that this person should be in hospital. Admitted. Head injury. Trauma. Repeated vomiting. You are having a headache and and having a nausea, vomiting after head injury, and the headache is pounding like you should be in hospital. Confusion and mental state, disorientation, difficulty in recognizing people, memory loss, agitation or unusual behaviors. You have seen some people when they are having headaches, they start having unusual behaviors. Yes, it's because when you have a headache, mostly when you have head injury, if you are not having hemorrhage inside, you're not bleeding, it means the nerves, the cranial nerves, the 12 cranial nerves are injured. And what are they doing? What they are doing is they are producing substance that is helping them to recover. And those substances are the ones which are causing you to have pain and feel vomiting. And what are the substances that those nerves are producing? Substance P, neurokinin A, and calcitonin gene-related peptide. You see, these are things. That's why you will see. I heard someone saying that I just had a headache, and right now I'm really vomiting badly. You have seen people that have headaches and they are vomiting. Now you relate why they vomit when it comes to headaches. You see, you can relate now why these people are vomiting. Calcitonin gene-related peptide, substance A, and neurokinin A. They are helping the nerve to recover, but in another way, they are doing what? They are injuring you. So we should not have people that are vomiting after head injury and severe headaches at home, because it may be bringing some things that may be complicated in future, things that may not help but only be fatal for life. So that is it about it. Let's talk about how can we know that you have this head injury. People do CT scans, people do MRIs, people do cervical spine X-ray to see if there is any damage between them. And if there is no damage, it is that you do an MRI, you do a cervical spine X-ray and CT, and then you find that there is no damage. What you should do, which is very important, you take mild analgesics and take rest. If it is throbbing and it is one side, maybe you are hit this side and it is one side, orbital unilateral, you will know the temporal region holds the trigeminal nerve. You will know that the trigeminal nerve has been injured, so it is producing those substances, inflammatory markers. And when it is producing them, the only good thing to do is to do what? Take rest. If it persists, what do? I've said take rest if CT scan, MRI, brain, cervical spine, and all those are okay. So when you take rest, what happens? When you take rest, serotonin levels go up. And when serotonin levels go up from the prefrontal cortex, it is released there. What happens? You start feeling better. Why? Because serotonin suppresses the inflammatory markers and your body feels better. So that is it. Take some analgesics. If it persists, you can do some antidepressants like serotonin serotonin agonists. Take some serotonin agonists. Feel nice. Treat intercranial bleeding surgically if it is required. if you are breathing inside your brain, the only thing you can do is take you to theater very fast. And when you are in theater, what do? We do a hole, and this is not a procedure for everyone. This one is done by someone called a neurosurgeon. We drain the blood and stop the bleeding, and we give you rest. Stop the blood, remove the clottings, and we give you blood. Headaches attributed to cranial or cervical vascular disorder. Anyone with a question? We have just started. The second one is another thing. Headaches attributed to cervical, to cranial nerve or cervical vascular disorder. Vascular disorders. When you talk about vascular disorders, we are talking about vessels, vasculars, blood vessels like veins. We have arteries. Here in the brain, we have several things. We have, look at this, we have circle of Willis, we have carotid arteries, we have external carotid artery, we have bacillary artery here, if you look so well, and posterior cerebral artery. So any of these can be injured, including the circle of Willis. But the circle of Willis is deep within. Sometimes it's not get injured. It's not injured unless it does not get injured unless you get an aneurysm. And aneurysm, I said, is an area of an artery that has dilated, and it's causing more blood to pressure against the meninges. Yeah, you get that? So that is head injury causing headaches, and most of the head injury does not have blood output. So what causes the headache? What causes the headache is what the nerves release for them to heal. They make you have headaches. Now, headaches attributed to cranial or cervical vascular disorders. Headaches attributed to cranial, or cranial is the cranium, the bone itself. So, cervical vasculars are the ones that I've named. The arteries, carotid arteries, circle of Willis. So they are among the most dangerous, because if your artery has loss of function, it means the intermediate organ will not get oxygen. If the intermediate organ does not get oxygen, the only problem you will get is necrosis. And necrosis is a term used to discuss what? Cell death. A place in your body where cells have died. So something like ischemic stroke caused by blocked cerebral artery. Cerebral arteries are the ones that I've shown you. This one, let me show you cerebral artery. This one is the cerebral artery. This one. Cerebral artery is the continuation of the circle of Willis. So if you block the cerebral artery, some part of your brain will not get oxygen. So you start having sudden headache, weakness, speech difficulty, and facial droop. Facial droop means if your face here droops, it means the trigeminal nerve is not doing its work. The innervation is down because it has ophthalmic, maxillary, and you see, even the muscles themselves, they get problems. Sudden weakness, speech difficulty, and facial droop. That is because your blood is not delivering enough oxygen, because there is a blockage. And what can block somewhere? What can block is like a blood clot. fat and bacterial growth, or weakness along the, you can have a weakness, have an aneurysm, and then it twists, and then you get a block. All those can be something that can happen in your brain. But we get them by doing a CT scan and MRI to see what has caused. And if you do a CT scan and MRI and you see one place is blocked, mostly the cerebral artery is the one which is the culprit. It usually blocks from clots and vegetative forms like bacterials and fungus can even block and make a point of weakness to twist. You do a CT scan and an MRI, and then you do blood works, you do full hemogram, you do lipid profile to find out what is the thing that is making this person having a block. You don't conclude only with a radiological finding. Don't conclude just with a radiological finding. Always conclude with laboratory works, blood works, both chemistry. You see, we will talk about blood works one day so that people know how to. You don't let anyone in the hospital coming as a doctor and then you are writing their tests when I'm asking, why did you ask for this? You cannot even comprehend. You are letting the patient do tests and using finances. If someone goes to school as a doctor, you should work like a professional and not like a quack. And that's why we give sensitization to the public, so that when a person goes to a hospital, if you are a quack, this person will question you, because community health practice sensitization is very important. Treatments are considered according to the finding, the diagnosis, and not an impression. An impression is what you think, but the proof is what the radiological findings and the blood works are saying. So don't treat against impressions, you treat against diagnosis. So you can do thrombolysis, selected patients, open the artery, you remove. And I've said this is a procedure of neurosurgeons. Don't open someone's skull and you're not a neurosurgeon. You'll be jailed. According to my country's rules, that is it, and FDA and WHO. Mechanical thrombectomy and antiplatelets. What are antiplatelets? Things like clopidogrel 75, aspirin, salicylate. Someone had a problem saying salicylic acid. Aspirin 75 milligrams according to INR findings, and thrombin time. What is thrombin time? We have a long way to go. We will do about these laboratory findings. Thrombin time is the time that thrombin takes to form a creel. You remember the coagulation profile from factor 9 to factor this, then to factor that. Start with factor 9, Hegman's factor, Christmas factor. I missed. Jassy, yes, I'm here. Last week was a bit complicated, but today we are here. That is Jassy. Welcome. And I've said when you come in, you tell us which country you are from, so that we can know how you practice in your country and how your medical health protocols are. There are some countries that don't go along with WHO, and they do some things differently, you see. So antiplatelets, those ones work. You should study about how these things work. The Christmas factor, anti-hemophilia A, anti-hemophilia B. The common pathway. You remember it, where we have fibrinogen being activated to fibrin, and then after fibrin, you remember those pathways, the common pathway, the extrinsic and intrinsic pathway. We will redo them so that people understand, because it is important. You see, even in the headaches, we still have antiplatelets, and for you to understand antiplatelets, you have to understand what is called clotting factors. On road, okay, nice one. This is Lucian. You are the one which is making noise for other people. Stop making noise on the chat. People are listening and taking notes, and you are yapping. Lucian, stop yapping and take notes. Now, intercerebral hemorrhage can be another thing. Intercerebral hemorrhage can be another thing. Bleeding into brain tissues. When you have sudden severe headache, most of the people, when they have sudden severe headache, they don't take immediate action. Sudden severe headaches are called, will always tell you there is a blood vessel that is bleeding, and it is pressuring the meninges. And then you start having reduced consciousness when you are at home and you've been growing it. You have to go to hospital and do a CT scan to check if there is a damage. We are talking about something that is called headaches secondary to injury in the head. And sometimes you can get an accident at home. You can get an accident. The coffee cakes. It's okay. Coffee cakes. Yeah. You can get an accident at home and feel everything is okay after some time. But after like 24 hours, mostly they happen after 36-24 hours, whereby you start feeling there is a point of weakness and sudden headache. You see, this is where computed tomography, CT scan, is needed. People with high blood pressure, they can get intracerebral hemorrhage. When you get to hypertensive crisis, these vessels of the brain, most of them are not big veins. They are small, like the left middle cerebral artery. They are small. So when they are exposed to high pressures, what they will do, they will burst. You see, they will burst, and that will cause hemorrhage that is causing pressure, and the mediators of inflammation that cause pain will come out, and we'll start feeling pain. You see, those are things that we should consider on headaches. You should get to hospital so that the control of high blood, busy at work but watching silently. Oh, Jay Hank, welcome, thanks. You will always go to hospital, a CT scan to be done, and a neurosurgeon will indicate where the problem is. And after a neurosurgeon indicates where the problem is, there is some steps to be done. This is now where we get a multi-sectoral association, nurses, theater nurses, neurosurgeons, doctor's assistants, trying to help this person. Hemorrhage across the meninges is not a good thing. You see, there is something called subarachnoid hemorrhage. These are caused by aneurysms. And aneurysms, I've said, where is my marker pen? Aneurysms, I want to explain about an aneurysm. This is the normal vein length, this one. And then you get a point of weakness, like this place. Get a point of weakness like this place. So what happens is, my pens are drying up. Let me get another one. Live, laugh, Marcia, welcome. So welcome, live, laugh. So this place, you see, this is the normal. I'm talking about this. I'm talking about these blood vessels in your brain. These blood vessels. These are the blood vessels of your brain. These ones. So one of these blood vessels, like this one. Let's take the posterior cerebral artery. Posterior cerebral artery. One of the blood vessels can have a problem, and then it becomes like this. A point of weakness, like this. This is totally different from something that is called a tumor. This is an aneurysm, an artery that has dilated the wrong way. So when it continues, maybe you are having high blood pressures. This may rupture. Rupturing will have a very strong headache once, and then it continues, because once a blood vessel ruptures, it continues to bleed. When you get to hospital, you tell a doctor, that has been a worst headache of my life. Thunderclap, and then it continues to bleed. You see? So, if you want to know if you have, when it ruptures, the pain continues. Once, first it's a thunderclap, you feel a lot of headache at once, and then it continues to be painful as it grows. The other thing is, because the brain meninges are being pushed by blood, the nerves of your head, the 12 cranial nerves, starts to get inflammation. Now your head becomes stiff. You cannot do this, you cannot do this. And that is why in meningitis, people have stiff neck. Vomiting comes in. Photophobia, because all the cranial nerves are being affected. And I said cranial nerves are the ones which help you to see, to innervate, to turn your eyes, to smell, to eat, to turn your... I usually like going through them so that people can know you have nerves that come from your head that give you sensations. Olfactory, smelling. Optic, seeing. Oculomotor, eye movement. Trochlea, eye movement. Trigeminal, eating. Facial sensation, maxillary and ophthalmic. 6, abscess, eye movement. Facial, taste. 2/3 from your here, 2/3. Glossopharyngeal, taste. 2/3 of the 1/3 after facial is glossopharyngeal. Number 9, accessory spinal. It helps you to shrug your shoulder and turn your neck. Number 10, cranial nerve number 10. What does it do? Parasympathetic activation. Helps the heart and the stomach. Very many things is doing in your stomach. You see, accessory spinal. And then we have the last one, hypoglossal, taste. Hypoglossal. See, those are the 12 cranial nerves. So one injury to the brain might cause you not to see, not to smell, not to feel your face. Your heart can go on pumping in a bad way, because vagus nerve helps in parasympathetic. Sympathetic means doing things faster, automatically, how your body does things faster. Parasympathetic, slowing down. So I gave an example. If you see a hyena coming at night, you will not wait. Your body will activate the flight mode faster. That is called parasympathetic. You see, your blood cells will constrict, adrenaline will come out, and you will run. But parasympathetic, when you are home, you are relaxed, your heart is beating. So that is the work of cranial nerve number 10. But now when you have injury to the head, all these things turn around. All these nerves start to produce inflammatory markers, and you start having a headache. You see, if you are the last person left on earth, what will be first thing? Hey, everyone, answer that question. Sometimes people ask here questions that I laugh. Let me read that. Let me read that. If you are the last person left on earth, what will you be? The first thing to do. Anyone that is from Lolagua CCCCC, yes? Lolagua CCCCC 7986, yes. Wanipe acha tulie, si unajua bado tunachukua output. Output ya 20 minutes nitakuwa nimemaliza within 30 minutes. Waende apigwe na upepo. Hello Lagu Dorothy, come. Amekula kidogo. Go take the pressures now and take and record. Acha pigwe na upepo. We continue taking the output for ya kwanza umeweka kando for 20 minutes. I'll be done by 30 minutes, alafu tutaachilia. Yes, you see that? Lolagu, you want me to answer that? No, you emphasis, answer that. Welcome, emphasis. Answer Lolagu's question. Answer Lolagu's question. It's a fine question. It's a good question. Confusion or altered mental state, seizures, weakness or numbness, all suggest that there is a problem in your head. Vision problem, speech problem, persistent. Those are things that you consider when someone has a head injury. Management, neurosurgical clips, those ones are done in theater. That's why I don't like talking about them. But pain control is important. Analgesics, nimodipine to reduce risk of vasospasm, because there are some things like headaches that come with brain injury. Those are not things that you can do at home. They are not things that you can do at home. No, those are very important things that you can only do in hospital and surgical areas like theaters. So let's just get to know them. But the practicing people here are doctors that are neurosurgeons and people that are qualified as physicians. Check this out. Very important. Yeah, you see, there are some things you need to consider when it comes to hospital management, like the jaw not moving, tender scalp, temporal headaches, one side. You see, these are very important things that you really need to consider. You really need to check, and you don't just say, someone got headaches and we are trying to give painkillers. We see how they are working. No, don't be a quack right now. You be someone who is understanding danger signs. Be someone who is understanding danger signs. Erythrocyte sedimentation rate, CRP, inflammatory measure markers, temporal artery biopsy, very important. We have something that is called cerebral venous thrombosis. Those ones are brought by oral contraceptives. We will talk about it today. I see our time is going out. Pregnancy, cerebral venous sinus thrombosis. Venous sinus thrombosis. Those ones are caused by pregnancies, oral contraceptives, women in the house, cancer, and thrombophilias. These are hormonal ways of family planning. And these hormonal ways of family planning, my friends, these hormonal ways of family planning, sometimes they have a problem. Before you start any family planning method, my friends, be careful. See a doctor. Let the doctor advise you the best way of family planning. You'll be giving yourself a heck of time by just starting. You're going over the counter and you tell them, give me the pills of family planning. There are several things you need to consider before you start family planning. It's even they can give you headaches. Tomorrow we'll do it. Cerebral venous sinus thrombosis. Headaches because of family planning issues and pregnancies. Even cancers and thrombophilias. We'll talk about them tomorrow. Where you have a blessing to each and everyone here. I sleep inside the kitchen to cook some cow heel. Hey, yeah. People have to get some protein. Uncle, people have to get some protein. Yes, people have to get some protein. And bodybuilding foods. People have to get some bodybuilding foods. People have to get some bodybuilding foods. Yes. Now we are still on. Tomorrow we'll talk about something that is called cerebral venous sinus thrombosis. But this one basically, I will talk about oral contraceptives and pregnancies because that is the most common. Some cancers are not even. Some cancers are not more common. I'll start with that and then I'll go to headache attributed to non-vascular disorders. So tomorrow I'll talk about two important things. Today I've talked about two things. I've talked about headaches attributed to head and neck injury and headaches attributed to cranial or cervical vascular disorders. You see, but tomorrow I will talk about headaches concerning oral contraceptives and pregnancies. And then I'll talk about something that is called head attributed to non-vascular intracranial disorder. So that is it. For this time, I'll ask if there is anyone who is here and has a question. It is time for asking a question. It is time. So true, Benjamin. I work every day, so I need it for my joints. Yes, so if there is anyone, it's time for questions. If anyone has a question, please place it out. Let me relieve myself as I come. I come. For now, be checking your head here. Your head. How your vasculars are here. Yeah. Yes, my guys, I can see people have looked and looked and learned. So no one has brought any question. It was a question time. If someone has a question, but no one. Today, or I'm teaching comprehensively. You know, sometimes when you teach comprehensively, when you teach comprehensively, people understand and then they cannot even ask a question. But today I was going slow because it was head injury, and I was not taking breaks because I wanted the flow to be, even if you rewatch, you are catching up with the flow. Yeah? So FRC, welcome, cute Jassy, my friend King Ray, Live Laugh TV, Marcia Thompson, Jamaican Uncle, the coffee cakes has said has been driving. We have a disturbing person that came in called Lucien. When you start having people in your channel like this one, you just know someone somewhere is jealous of something. But you know, jealousy is a normal thing. It's a disease. It's a disease. People are having jealous, and it's okay. Now, guys, it's been last week has been like this, like that. How do you feel about this week? We continue having the talks and talks and talks and talks. You know, we continue mingling and telling people the best thing you can. This is my always green tea. So everyone who is here, and you are hearing me saying this thing, you guys, let's talk of headaches because of something. If you are waking up every day with headaches, you need to see a doctor. Let me just talk slowly. Like when you are waking up every day with headaches, you need to see a doctor or get some guidance. And you've seen one of us here was here and was waking up with a headache, and we have given guidance about it. You see, guidance is the best thing when it comes to chronic headaches. There are some headaches that don't need painkillers. There are some headaches that need analgesics. And there are some headaches that need antidepressants. You see? So you that is there, what do you think the kind of headache you're getting is coming from? What do you think? The kind of headaches, is it because of stress, or tell me? If you have a question, tell me. Yes. Tell me how you think tell me how you think the headaches come from. Sometimes headaches can be pounding, they can be so bad. But we thank God. So tomorrow we will talk about those topics that I've said, those topics that we have. So anyone who has something to tell me, my friends, anyone who has something to tell me, let me give like 2 minutes. 2 minutes. Anyone who has something to tell me, come on board. Two minutes. Then we say God is good. By the way, Building Legacy is here. Welcome, Building Legacy. Thank you for tuning in. By the way, let me ask something. Do anyone has? I have a friend called Elaine Podiahu, one of us here. If you have, I only have the email address. If you have her number, please call her and tell her we miss her so much. We have not seen her for so long. So Building Legacy, welcome. It's always a pleasure. Welcome to this chat. And guys, Building Legacy has a channel. If you can go to Building Legacy's channel and watch her. Yeah? Let me name out people that have channels. Cute Jesse, Jamaican Uncle on top, Building Legacy Farm, and Live Laugh TV, J Kingre, J Hank, and Coffee Cakes, Kingre, and anyone, Ahmed, who is called Chaudhrian Mehagaman, and we have African Mom, we have Dorothy K, we have Jayan Beauty Slay. All these people have channels. Please, if you have not liked, please hit the like button, double tap your screen. I can see my time is going out. You have seen I've started being called. and when I've started being called, it will be you'll be hearing, doctor, you are called, doctor, you are called. So I think my time is getting out. If you are here watching and you have not hit the like button, please, my friend, hit the like button. So any question that you have and feel like maybe I'm offline, you can just post it under the video that you have watched. See? So it is important to follow up on these things. So guys, I think I will end there for today. Here it is 6 p.m. so that I can see other patients, and because I want to support other people. When it comes to 7, when people are taking their supper, I'll be online supporting, putting some like Jamaican Uncle. When it comes to your time, I have to support, So thank you so much for being here. Hope you have learned something today, and welcome again when you have the next live session tomorrow at 16:30. Blessings everyone. Bye.